All right, guys, welcome back to Underground Science. In this video, we'll be talking about IPEX syndrome. So let's go and get started. So this is relating to regulatory T cells, right? And just general summary, right? So a review, regulatory T cells, remember, they are three things. They are CD4 positive, right? Because they're T cells. They're CD25 positive. Remember CD25 when we talked about CD25 polymorphisms? CD25 is a critical subunit of interleukin 2 receptor. So regulatory T cells are CD4 positive, CD25 positive, and FOXP3 positive. Okay. So if there's mutations in the FOXP3 gene, then you won't have proper functioning FOXP3 protein, right? And if there's mutations in the FOXP3 gene, that's going to lead to IPEX syndrome. Because if you don't have proper FOXP3 function, if you don't have functional FOXP3, then you won't have functional regulatory T cells because FOXP3 is a critical part of regulatory T cells, right? It's a critical protein, right, for regulatory T cells for their normal function. And if regulatory T cells don't work properly, as we know, you're going to be more prone to autoimmune attacks because regulatory T cells play a really important role in peripheral tolerance. If you don't have functional regulatory T cells due to a FOXP3 mutation, because remember, FOXP3 is a what? Transcription factor. It's a transcription factor. It's a protein. That's really important for the development, maintenance, and the overall function of T regulatory cells. If there's a mutation in that FOXP3 gene, you don't have proper functioning FOXP3 protein, which means you won't have functional T regulatory cells, which means you won't have proper peripheral tolerance. If you don't have proper peripheral tolerance, remember that what do regulatory T cells usually do? They stop activation of autoreactive T cells, of self-reactive T cells. But if your regulatory T cells don't function anymore due to the FOXP3 mutation, you can't stop your self-reactive T cells from getting activated and destroying your own tissue. So we see autoimmunity here, right? So again, the mutations in the FOXP3 gene leads to IPEX syndrome. Now, IPEX syndrome, right? The IPEX part is actually the mnemonic in which we can remember this syndrome, right? So the I, we can remember immune dysregulation. So you have increased or recurrent infections, right? E, we can remember that stands for polyendocrinopathy, right? We'll talk about specifically what in a bit, okay? E, right? So I remember E, there's like many E's, right? So one is enteropathy. The next is eczema, right? So atopic dermatitis. Then another word for E would be eosinophilia, right? And then you can also find increased IgE, cytopenia, right? So that's just how I remember the E part of the IPEX mnemonic. So cytopenia, right? So you can generate autoantibodies, right? Because you don't have functional regulatory T cells, so nothing's stopping you from generating these antibodies because you don't have peripheral tolerance anymore, right? So you can generate autoantibodies against what? Your red blood cells, leading to autoimmune hemolytic anemia, your platelets, leading to ITP or thrombocytopenia, and you can also generate antibodies against glutamic acid decarboxylase. Remember, glutamic acid decarboxylase does what? It converts glutamic acid into GABA, right? So remember, this is important in the pancreas when talking about the pancreas because you need this reaction to happen for proper functioning of your pancreas and proper release of insulin, right? If you have antibodies against this, oh, and well, I forgot the most important part, right? Who does this reaction? Glutamic acid decarboxylase, right? So that means that another product would be CO2 because you're decarboxylating. But if you have antibodies against this enzyme, right, then you won't be able to make proper GABA in your pancreas. And it's important, GABA is important for the proper release of insulin. So if you're destroying this enzyme, right, then you won't be able to, do what? Secrete insulin. So that means that that can obviously be related to type 1 diabetes, right? So it's common to see glutamic acid decarboxylase antibodies in those with type 1 diabetes mellitus. All right. So, and then the X obviously would be for X linked, right? So in terms of polyendocrinopathy, right, we can, one of those we just mentioned is type 1 diabetes. So that would, one of those would be type 1 diabetes. But like in terms of autoimmune features, right, part of the E that I remember, right, is, so we said cytopenias, right? And then I also remember E for energy, right? So that's another way that I remember thyroiditis, right? Autoimmune thyroiditis. So I remember E for energy, right? And we know the thyroid gland is important for, having energy. So that's how I remember that, okay, another finding would be autoimmune thyroiditis. So we can even write that down. Autoimmune thyroiditis. And then another way that I remember this finding of hepatitis, right? It's another autoimmune feature that can be related to IPEX syndrome. Is I remember the enzyme vitamin K E oxide reductase. I know it's a weird way, but remember this enzyme is present in your hepatocytes, which hepatocytes make up your liver. So that's how I remember hepatitis, right? Is another finding for IPEX syndrome, part of the E mnemonic, right? Or part of the E in the IPEX mnemonic. Remember vitamin K E epoxide reductase. Um, remember this is important for activating vitamin K and also important for production of factors 2, 7, 9, 10, CNS, right? Which we'll talk about when we talk about like clotting disorders and whatnot and coagulopathies. So we got enteropathy, eczema, eosinophilia, IgE, cytopenia, right? And then you can also remember E for energy, so autoimmune thyroiditis, and then E for vitamin K, E, epoxide reductase, right, is present in your hepatocytes. Hepatocytes make up your liver, and then that's how I remember hepatitis is also another feature, autoimmune feature of um, IPEX syndrome. All right. And then that's basically it. So just remember FOXP3 mutation leads to IPEX syndrome, and just remember the IPEX mnemonic, right? And then just remember you form multiple antibodies, not just against your red blood cells, white blood cells, platelets, but also your thyroid gland and against, you can even generate antibodies against insulin too, not just glutamic acid decarboxylase, right? So that this can also contribute to your type 1 diabetes mellitus. Okay. And then so that's the basics of IPEX syndrome. All right. So now we can quickly talk about the clinical features, right, of IPEX syndrome. So what did we say, right? We said enteropathy was one of the findings in the E part of the IPEX mnemonic, right? So if we're talking about if this affecting infants, right, we can see what would enteropathy show, right? What clinical feature would we see? If it would be chronic watery diarrhea, right? And why would this happen? So let's write that down. So remember, the first one that we said was enteropathy, right? That's a clinical finding in IPEX syndrome. And when we're talking about infants, right, you would see chronic watery diarrhea. And why would you see this? Because remember, IPEX syndrome is autoimmune. It's an autoimmune issue. So you see autoimmune destruction, right, of intestinal villi. Why is there autoimmune destruction? Because you have a FOXP3 mutation, which means you don't have functional regulatory T cells, because FOXP3 is important for function of regulatory T cells. If you don't have proper regulatory T cell function, you get increased autoimmune reactions, right? So you have autoimmune destruction of your intestinal villi, which can lead to chronic watery diarrhea, right? And malabsorption, because we know villi is important for increasing surface area and absorbing nutrients. So you're going to have in enteropathy, you'll have severe watery diarrhea plus malabsorption, right? That's a clinical feature. Now, what else did we say? We said we see eczema, right? So, of course, this eczema is also going to be due to the fact that you have increased increased immune activity, right? Increased autoimmune activity due to regulatory T cell suppression. We also said you see polyendocrinopathy, right? One of them being type 1 diabetes mellitus. And we said that was due to the autoimmune destruction of your pancreatic beta cells. Okay, so you may see hyperglycemia, right? Because you're not producing insulin anymore, and insulin is responsible for taking glucose in your blood and putting inside your muscle and fat cells, for example. Okay, and another thing we said, right? Part of the E part of the IPEX mnemonic, we said E for energy, and thyroid gland is important for that. So that's a way to remember that in IPEX syndrome, you also see autoimmune destruction of your thyroid gland, right? So autoimmune thyroiditis, which can lead to hypothyroidism. All right. And then another thing that we didn't mention, but if you want, you can also use this, right, as part of the mnemonic for the E part of the IPEX mnemonic is kid knee. Okay, the E emphasis. Because what can happen is you can also get immune complexes that deposit into your kidneys, right? Into your glomeruli. So you can get autoimmune glomerulonephritis. All right. So you can get autoimmune glomerulonephritis. All right. So it can affect your kidneys also. And then, so let's move on, right? We also talked about cytopenias, right? So remember cytopenias, right? We talked about antibodies against your red blood cells, white blood cells, platelets. So if you have antibodies against your red blood cells, this can lead to autoimmune hemolytic anemia, right? So of course, part of the name is you'll get anemia from this, and you're going to have hemolysis. So you can expect things like increased schistocytes, right, on blood smear. You can see things like increased LDH, increased hemoglobin in the blood, and decreased haptoglobin because we know haptoglobin binds hemoglobin and things like that, right? So you can see autoimmune hemolytic anemia. And then, of course, symptoms for anemia too. So like weakness, pallor, and things like that. So that's for that. And then we also said, right, you can generate antibodies against your platelets. So that can lead to immune thrombocytopenic purpura. Immune, because you're generating autoantibodies. Thrombocytopenic, because those antibodies bind your platelets and then get destroyed in your spleen, therefore reducing platelet count. And purpura, because you see skin and mucosal bleeding, right? You see skin bleeding, which is a symptom of low platelets, which can be a symptom of low platelets. So that purpura makes sense, right? And then you can also have autoantibodies against your neutrophils, leading to neutropenia. So you may see increased recurrent infections, right? So that's taking care of the cytopenias. And then we said E, um, another way to remember hepatitis we said was what? Vitamin K, E, oxide reductase. That's just a way I use to remember that hepatitis is also a finding for IPEX syndrome, right? Autoimmune hepatitis, autoimmune hepatitis. Okay, so it's obviously going to be T cell mediated, right? T cell mediated autoimmune hepatitis, because nothing's stopping these T cells, right? Like if these self-reactive T cells escape central tolerance and your regulatory T cells are already not functioning, so you don't have peripheral tolerance. So nothing's stopping these autoimmune T cells from causing destruction of your hepatocytes, leading to autoimmune hepatitis, right? So that's that. And then that's basically it. And then just remember the E part, right? Increased IgE, eosinophilia, and so on. All right. And then that's basically it for this video. I hope it wasn't too confusing. Thank you guys for watching. Hope you guys learned a little bit. See you guys in my future videos.